What was the most common STD in the 70s? You're about to find out. Back in the 70s, there were very few treatments available for most of these infections. And what was considered the most common STD back then was genital herpes. And it's still one of the most common STDs today. In fact, 1 in 6 people will get genital herpes in their lifetime. But back in the 70s, how did we treat them? Well, there was no specific antiviral medications. So the treatments were really focused on symptomatic relief. So things that would relieve the symptoms, but not actually cure the infection. So the main treatment was bed rest. Yes, I said bed rest. So people would be told to stay in bed, keep the area clean and dry, and just rest until the lesions kind of healed on their own. This could take anywhere from 2 to 6 weeks. The second thing that we used to do is give people a sitz bath. A sitz bath is basically where you sit over a tub of warm water, like 40 degrees Celsius or 104 degrees Fahrenheit for 15 to 20 minutes at a time, 3 to 4 times a day. And this was to relieve pain and discomfort from the lesions, which are very painful when they first appear. The third thing that we would do is prescribe things like benzodiazepines, Valium or Librium to help relieve some of the anxiety and the pain associated with these lesions. And sometimes even aspirin or acetaminophen for the pain as well. Lastly, we would prescribe some topical medications. These were either a cream or a lotion that you would apply to the lesions 3 to 4 times a day. These were usually a combination of things like zinc oxide, which is a very common ingredient in diaper rash creams, as well as some local anesthetics. There was also some data to suggest that using tea tree oil or drawing a warm bath with Epsom salts could also relieve some of the symptoms. Now, it's important to know that all of these are still options for treatment today. However, we also have some antiviral medications that can shorten the duration of symptoms as well as shorten the time that it takes for these lesions to heal. In fact, a study showed that acyclovir, which is an antiviral medication, given within 5 days of the onset of these lesions can reduce the healing time by 4 days. So from 2 to 6 weeks down to 2 to 6 weeks. That's a huge difference, right? And I've made a video about what you should know about taking acyclovir or valacyclovir for genital herpes. So make sure you check that video out. Bottom line is there's a lot of things you can do to help relieve the symptoms of genital herpes, whether it's acyclovir or these other treatments. Make sure you talk to your doctor about them. As always, I hope you enjoyed this video. And remember to take care of yourself because you're worth it.